Oh, you're watching us anyhow, all right. So welcome, everybody. Thank you for joining our first Lunch and Learn. My name is David Kennedy, and this is Dr. Steve Haler. We actually share a lab together. People often can't tell us apart, probably because I can bench press just as much as he can.
We just look so much alike.
I just want to do a quick check-in. How many M2s are here? So it's essentially everybody. So M2s, so we're also in charge of your life for the next 13 weeks.
Yeah, this is actually a trip. We're going to talk about embryology.
Yeah. So how is it going? We just wanted to check in. How's it going? Good? Bad? Indifferent? Any comments? Complaints? Concerns? No? All right. I'm going to take that as things are going okay. But these are nice opportunities for us to kind of check in outside of VFUN, et cetera. So if you have, questions, comments, concerns, things aren't making sense, please just let us know. So welcome to this. So this is the Department of Medicine Mentored Research Program. This is our first Lunch and Learn, just the orientation. And we'll just go through a couple of things very briefly in general about why this has started. Obviously, the LCME is really interested in making sure that you guys have good research experiences, and they assess this. And the last time this was asked, we had 35% of the medical students who were dissatisfied with their research opportunities, and also, roughly about a third for their support for participation in research. So those are good, percentages. Maybe not good, they're actually bad, but sizable numbers. And so we wanted to do something about that. Obviously, I think for many of you, most of you are M2s, so some of you may have participated in, I know some of them are here, in the MSRP, the Medical Summer Research Program. I don't know if we have a quick show of hands of who's been involved in that. So a lot. Okay. So this is different than that. That's in between first year and second year, and it gives you 8 weeks. It's very intensive. But and then obviously you can do research electives. So those are sort of the big main opportunities. And we wanted to come up with something because we actually, I think you were the first class, or M2s, we put a survey, I think last September. So when you were M1s, you took this survey, and we said, who's interested in research? We thought we'd get, everyone would be busy with their stuff. We thought we'd get maybe 15 or 20, and we had 180 participants. People said, we want to do research. And our jaws kind of hit the floor, and we said, okay, we're going to have to scale this up a bit. So this is kind of the version of what's been scaled up. I want to give a shout out to Dr. Lance Dworkin, who's our chair. He's the chair of medicine. You're going to notice this is the Department of Medicine. This is the program that Dr. Dworkin wanted to roll out for the department. So we'll talk a little bit about this, but essentially, we can talk about what's going on in the Department of Medicine. That encompasses a lot, but it's not everything, right? It's not pathology, it's not surgery, it's not a couple other things. So we can only do what we can do. There is a lot in medicine that's going on, so we're going to talk about that and how we want to have an integrated research opportunity. So essentially, you have participated in why is this not advancing? There we go. So your M2s, you've participated in most of, and I know there's M3s and M4s on the line as well, the research curriculum. So that was in response to LCME to provide a didactic curriculum. So you've taken 16 of the sessions already if you've been through the M1 year. This year's M2s, there will be 4 review sessions. And that sort of forms the foundation. So we've talked about biostatistics, and we've talked about trial design, and we've talked about animal models and precision medicine and all these things, and we've given you those didactic sessions. we want to build on that with these sessions. So those sessions are great for the very formal stuff, you know, like I'm not going to tell you how to run a t-test or the difference between an ANOVA and an ANCOVA. But we can give you in these lunch and learns, our desire is that the Department of Medicine would give you some interactive sessions where we can talk about other things, and Dr. Heller will talk about some of those, but some of the intangibles that go around research. I don't know if there's just a medical student last night that we're working on a research project together, and I said, you know, I appreciate that when my mentors, you know, mentored me, they didn't just tell me how to run a test, or, you know, they didn't tell me, you know, just proper trial design or anything like that. They told me about all the other things. You know, they helped me to network. They helped my professional growth and development. They kind of pulled back the curtain so I could see behind the scenes about what goes on, and that's really important as you engage in research. So we want these lunch and learn series to be a nice informal way where we can start with a topic and center a conversation around that topic, but that you can interact not just with the two of us, but with some other faculty members that we'll bring in. And again, those will be typically on the last Wednesday of the month. Sometimes we have to change that around based on schedules, but typically these will be on the last Wednesday of the month. They'll be in person, they'll be in this room by and large, and then they're run as a hybrid meeting. So that's the you know, one of the really important foundations of this research experience. Next thing are the Department of Medicine seminars and journal clubs. So we want to make it, we'll show you some of the things that we've done to make this more accessible, but essentially there's already a lot of research going on in medicine, and we just want to make it more accessible to you. So this isn't anything we have to invent or whatever it's going on. So there's our Grand Round series. So we have a medicine Grand Round series, which is much more clinically oriented. We have a research Grand Round series, which occurs once a month, where translational, clinical and translational research scientists from around the world and around the country come and present. Those are fantastic opportunities for you to get involved in clinical translational research. So those will be made available to you so you can participate. There's also a journal club, and Dr. Heller will talk about that, a new journal club that we're rolling out with medical students in mind, so that you can participate in those things. Then all, you know, everything boils down to, especially in medicine, into what division that you're working in. So some may be interested in dermatology, some may be interested in GI, cardiology, etc. Each of the divisions in the Department of Medicine has things that they do every day, every week that revolve around research. And so we, again, wanted to, this isn't something that we had to like create or whatever, but we wanted to make it more accessible to you, and we'll go over the how we're doing that with the calendar that we're creating. So that essentially you have a one-stop shop to, you know, dermatology as an example, is very competitive, to get into. If I'm interested in dermatology, what's going on in dermatology? How can I start to meet the faculty members that are in dermatology, the residents? Are there research projects going on? These are the kind of things that we want to make accessible, and you can insert, you know, discipline, medicine, subspecialty of your choice. But these are the sorts of things that are important. When there's a journal club in dermatology and one of the residents or the faculty members is presenting, this is a great opportunity for you as a medical student to get involved, to know what's going on, so that you can start to understand, like, oh, I had no idea that, you know, this aspect of Mohs surgery was really important and that there was a critical need. Gosh, I can start thinking about that. Dr. Parquet, is there anything that's going on that, you know, that we could do, you know, as a literature review, et cetera? So we want to foster those experiences so that you can start to get involved and bump elbows with the faculty, the residents, and the fellows that are involved in the different specialties. So that's that's at the division level. The next thing is obviously active participation in division research, and I think this is what most people think about. You know, I'm going to run a clinical trial, or I'm going to do a case report series, etc. So we want to facilitate those interactions. It's not for everybody. and you have to respect that, and you have to know your limits. You know, if it was me, you know, I'd be lucky to, you know, you know, when I was in graduate school, I was lucky to keep my head above water with, you know, the didactic coursework that I was doing, and that's okay, all right? We've designed this program so that you can be involved at essentially any level that meets your comfort level, and this is like, you know, Planet Fitness, it's the no judgment zone. I don't care if you're, you know, running a randomized controls, you know, trial, you know, international, you know, a study, or if you're doing a literature review. It really, you know, it really doesn't matter. Our interest is in providing you with a meaningful experience where you can get something out of it and you can actually do it, right? It makes no sense to like talk about like a ridiculous trial that you'll never actually actualize. You know, in the end, you want something that's on your CV that when you're applying to residencies and fellowships, you can have some sort of concrete experience, and we try to give that, and we'll talk a little bit about that. And then finally, obviously, the you know, top of the pyramid here is publication and presentation. We'll talk about some of the ways that we're going to give you opportunities, you know, to do that. So I'm going to hand it over to Dr. Haller just to talk about the Lunch and Learn series, and I'll pass this over.
All right, so the Lunch and Learn series. So as Dr. Kennedy mentioned, we designed these primarily based on student feedback, right? We want these to be very practical seminar series, and really, I shouldn't say seminar, we want it to be more interactive. And it's not just about research, it's about fostering your career development. So I'll just run you through the list here. So we're going to talk about fundamentals of formulating a research question, preparing abstracts and abstract poster design, preparing manuscripts and case reports, oral presentation design and skills, creating attractive figures and schematics, and for that we primarily use this program called BioRender that's very nice and helps you generate a lot of really nice figures for posters and abstracts. Designing research projects using publicly available data sets, writing a compelling literature review, developing your CV, developing positive mentor-mentee relationships, developing professional contacts and becoming an active seminar participant, women in science and medicine, and we'll also run you through the NIH Introduction to the Principles and Practice of Clinical Research course modules. And here, as Dr. Kennedy mentioned, we are also starting up a new translational medicine journal club. So this will be once per month, but the date and time is still being decided, so please let us know some different dates and times that will work with your schedule so that you can get involved. And this is really open to graduate, undergraduate, medical students, and pharmacy students, and there'll be a 1-hour meeting focused on improving your skills in peer review. So how to be a good active peer reviewer. And it's an opportunity for expanding your understanding of multidisciplinary translation research.
Oh, sure. So yeah, so along those lines, actually, just so we can again keep this interactive. So we're kicking around some days and times for that journal club. I want to make sure we don't ignore the M3s and M4s who are online, so you can type things in the chat as well. But for, you know, as for the majority of you are M2s, is there a good day or time that you know works for you? You're not allowed to say like Saturday night, but is there, you know, are these Wednesdays at noon? Are they good for you? Is there a certain you know, day or time that you know you want to suggest for those as we're planning? All right, let's have a show of hands for Wednesdays at noon are awesome. Okay. Let's have a show of hands on Wednesdays at noon are awful. Awful. What are you doing here? It's Wednesday at noon. Okay. Any other day? How about a show of hands for weekends would be great for me. I'm going to ignore you if you said it. So.
You won't see me there.
Okay. Any other days that we please shout it out? Any day time, but noon seems to be a good thing over the lunch hour. Yeah. All right. Okay. And online, please, if you just type in the chat, that's good. The other thing is that the importance of this, and we'll talk, so this is our public service announcement. I don't know, and I can't see out my glasses. I don't know if Justin or Dan are on.
Hi, Dr. Kennedy. Hi, Dr. Haller.
Hey, welcome, welcome. So, all right, Justin, take it away. I'm gonna let you talk about this public service announcement.
Sure. Yep. So on Sunday, August 7th, the University of Toledo's Journal of Medical Sciences Translation is putting on an event. We're going to train students how to participate in academic publishing as a student reviewer. And I just posted a link to the WebEx in the chat, and we'll be happy to teach anybody who comes. Everyone's welcome.
Awesome. Thank you very much. And this really ties into the Journal Club. How many people have participated in a Journal Club before? All right, a couple. How many people liked Journal Club that they participated in? That's what we thought. So the key is that when we rolled out a Journal Club, like, sometimes I think I need another Journal Club, like I need a hole in the head. We wanted to make it something that was useful to you. So this ties in perfectly with what Justin just said. This Journal Club is going to be focused on how do you peer review. And so Dr. Heller and I sit on a number of editorial boards, and one of the big complaints that we get is that peer reviewers are providing like junky feedback. It's really not worth it. It's almost like they haven't learned how to review a paper. And we said, wow, this is a great opportunity. We can teach our medical students how to review a journal paper so that when you get out and do these things, you'll know what you're doing and you won't feel like totally like a fish out of water. And then also this ties in with what Justin just mentioned. Our journal translation is going to have opportunities for students, medical students, to be peer reviewers. So again, that's something you can align that you can put on your CV. And this will be the first talk on August 7th. You can join by WebEx. So it's a great opportunity to learn from experts about how to do this, and then also how to get involved as a peer reviewer. All right. There we go. Okay. So next, a couple things we want to talk about. There are what goes on at the division. And at the level of the division. So what we've done is we've organized all the divisions in the Department of Medicine into teams for this mentored student research project. So the basic division team is a faculty member, one point person faculty member who's familiar with the division research. There's an administrative and staff person who will be involved in helping to make sure that communication is being facilitated. And then if a division has fellows, we've tried to get the fellows involved. If they don't have a fellow, we've tried to get the residents involved. Because honestly, the fellows and the residents are the ones who really know what's going on, and our experience has been that the residents and the fellows have excellent interactions with the medical students. This is where a lot of sort of like mid-level mentoring is going on. So again, they serve this essentially minimum 3-person team for each division serves to coordinate things. There's also our research project center. So Dr. Dworkin, the chair of medicine. How many people have met Dr. Dworkin? I don't know how many people have met yet. You may or may not. You will in your M3 and M4 years. So he's created a research project center. Again, he's very committed to this, so he's trying to give resources to the medical students. We'll talk about that. And then also the Biomedical Research Society. So we've got Justin, thank you, on the line, and we'll talk a little bit about that. This is what it looks like. I didn't want this to be too tiny, so we just put on the faculty contact and the admin contact right now. This will be up on the website, so you can see sort of who's the point person for research in these divisions and knows what's going on. You can see all the different divisions there. This is the Research Project Center website. So again, the Department of Medicine has its own Research Project Center, and it's staffed with faculty who are there to help you. You've met Amy Phillips, who's wonderful. And really helps coordinate a lot of the communications, etc. So she's on there. Diane McCarthy on the left-hand side is the director of the Research Project Center. She's very involved and very hands-on and good about following up. Shauna Glover helps to do, you probably will not interact as much with her. She's more on the finance side, but you will potentially get involved if there are expenses and things like that that are involved in the research. And then Umi Sharma, who is a project coordinator, but has helped us a lot with the website. So these are, just so you can put a name and a face, these are some of the people involved. We also have many of you have had class with Dr. Cooter. Dr. Dworkin just hired another statistician to help Dr. Cooter. His name is Alex Davis. His email is there. So Dr. Cooter or Dr. Dworkin wanted to have, we understand you've had classes in, biostatistics, et cetera, but it's good to have somebody who can hold your hand and walk through this, this process with you. So he hired Alex Davis, who has a master's degree, and worked with Dr. Cooter on statistics needs. So these are the point people for that. It's really pretty incredible. I don't know any other department that does this, and I'm not talking just at University of Toledo. I mean just Cleveland, Columbus, Cincinnati, Ann Arbor. I don't know anybody else that is given these resources to medical students. So that's a big kudos to Dr. Dworkin for supporting this, really putting his money where his mouth is. And then I'm going to briefly introduce the Biomedical Research Society, but let Justin Creedon talk about that. So again, we're not interested in reinventing the wheel. The Biomedical Research Society, how many people are familiar with the Biomedical Research Society or involved? So we've got one. Okay. So the Biomedical Research Society is a student organization. I have a feeling it's going to be the largest. And it's a teams-based project collaboration to getting research done. Each Department of Medicine division will have a team that's associated. So, cardiology will have a team of the Biomedical Research Society that's associated with the Biomedical Research Society, as vice chairs or co-chairs as a point of contact. And their job is to collaborate with the division and facilitate student engagement and project tracking. Justin, I didn't put the slides up here. We could run through those, but if you just want to give a brief rundown of how this works and how people can get involved, et cetera, in the Biomedical Research Society.
Sure. Yeah. So thanks, Dr. Kennedy. Thanks, Dr. Haller. So my name is Justin Creedon. As Dr. Kennedy introduced me, I'm the director of the Biomedical Research Society. So we're the student side of things. Our sort of orientation is to champion student research, try and get everybody increased research metrics, pump up CVs, and also educate everyone on the best way to perform research and participate in research from a medical professional standpoint. So I can, Dr. Kennedy or Dr. Haller, I'm sure will give you guys a link at some point to the Teams page and the form that we ask everyone to fill out if they are interested in joining a research project. Basically, we have faculty submit projects and we have students submit interest forms. And then we match those faculty and those students together so that we can create these teams that produce manuscripts and posters and abstracts. And so far, we've been really successful and very productive, and we're very excited to collaborate with the Department of Medicine and Drs. Kennedy, Dr. Haller, and Dr. Lance Dworkin. Moving forward, we think this is going to be a really good thing for everybody.
Awesome, thank you very much. If you have the link, if you could also drop it in the chat just as a belt and suspenders, but we're going to walk through those links in a second too.
I'll do that now. Thank you.
Awesome. Thank you. And speaking of the website, so we have a website. It's still a work in progress, but most of the components are there, and we will go through some of those. This may look a little different, but we'll start with this. So the link is there again. We can drop it in the chat. So this is the Department of Medicine's Medical Student Mentored Research Program website. And the first thing that you'll notice on here at the very top, again, these are going to be collapsed. Right now we have them just listed out in order, so we'll just run through it. But this first part is a calendar, all right? So this is your one-stop shop for what's going on. And you see up at the top, you can click on the discipline that you're interested in, and it'll limit it to those things. So if you're interested in nephrology, just click the nephrology link and you'll see what's going on week to week, month to month, et cetera, in those things. You can also, if you want to do workshops, et cetera, that's all that is out there. It's just click. And then you can see down in the actual individual days, you can click on those links. It'll tell you how to where the event is being hosted, if there's WebEx information, if it's hybrid, et cetera. So all that is right there. Again, this is under construction. So what we've asked to do, what happens now, just this is maybe inside baseball, and you don't need to know, but all the divisions do all these things, and they do them in one format or another. What we're asking the divisions to do is to just directly upload their stuff to this link, which you won't see. That's on the backside, so that the information is accurate, up to date, etc. So not everything. This is obviously on the other side. We're working with the students, but we're also working with the administrators on the other side to orient them and get them to do this. So what's up there is what's up there for right now. Our goal is to have 100% of the divisions participating, but that's how it looks. So that's the calendar. As we're scrolling down, you can read about this program, the prerequisites. We're not going to read through all this stuff. Learning objectives, et cetera, and program expectations. What we will stop and do is talk. So Justin just talked about how do I know if I'm interested in research, I'm interested in dermatology research. How do I let somebody know? So that's the link over here, and we can go ahead and click on that. This takes you to a form, which we try to make very easy, and this is just you can walk through it, but it's just basic information, how to get a hold of you, what you're interested in, etc. And so when you hit submit on this form, it goes to the Biomedical Research Society in our group, and so we know, and it's logged. All right, Sally Smith is interested in GI, so we have that on our end. So that's how you interact and say what you're interested in, and that's all I'll say about that. The faculty also do the same thing. So faculty on our side say, hey, I've got a project in GI research, and here's what it is. It's a literature review. It's whatever. So they fill that out too. So then we have the matchmaking where you like chocolate, I like peanut butter. Let's get together. And that occurs in through the Biomedical Research Society and the groups that they already have set up. So again, we didn't want to create layers of bureaucracy and confusion and whatever. The Biomedical Research Society, God bless them, already has a format to do this and work with people. They have representatives. They also may not have a representative for a particular division, at which point you can volunteer and say, hey, I would like to be the representative for cardiology to help facilitate the communication. An opportunity for you. What else do we do? The contract. Okay. So you have now, you like chocolate, they like peanut butter, you've got a match made in heaven, and now what's next? So we have a contract that you can fill out with a mentor, all right? So this is, once it's gotten to the level of, all right, you have this mentor. Again, we wanted to make this very easy and give you options, and you'll see what is research, all right? It is not all randomized controlled clinical trials, right, which are totally unrealistic for 99% of the people. So there's literature reviews, case reports, observational studies, etc. So this is super easy, you just click, all right? And briefly describe the project. You will have already known this because you've agreed on a project. You can copy and paste and drop it in there. We want you to discuss with your mentor some learning objectives, right? What should you be getting out of this? So again, we made it super easy, just click. Click on a couple of them. These are the learning objectives. This is what we want to focus on. You don't have to spend a lot of time, thinking or wondering about it. And then a timeline for completion of the activities, right? There should be a beginning, a middle, and an end, right? So you know, like, when am I done? And then your plans for doing something with this, right? It does no good to say that I did research with, a world famous nephrologist if there's no record of it or, whatever. So a timeline completion, you enter your name, initials, you're gonna hit the submit button, and that will generate a couple things. It will generate this contract, which will go to you, it will go to your faculty mentor, and it will come to us, all right? So that there's a record, we can, there's metrics we can check, how are things going? Have you had the appropriate conversations? We've also, on the other side, again, sort of behind the scenes, we've talked with the faculty in medicine and tried to, talk to them about best practices for mentoring, et cetera. So that's the contract, and that's very important. At the end of the experience, there's an evaluation form for you so that you can get feedback from your mentor on how they do. Did I do okay? Are there things I need to improve on? Again, that's submitted, and when that gets submitted, you get a copy, they get a copy, and so that's great. Just a second. Okay. That was easy. The link worked. And the last thing that your evaluation of the mentor. How did they do? So, and again, we've made this so that once you submit this, it's anonymous. You don't have to. The evaluation goes in of your mentor. We will get a copy of that and can review it with the mentor. But again, it's an opportunity to give some feedback.
This part is particularly important because it gives us a chance to see, how are things working out? What are some of the main issues? And what can we do to improve this?
So, pretty easy. We've gone over the contract, we've gone over the evaluations that are there. On the website, the link to the Biomedical Research Society, again, we talked about that. But this is where you can find a link. I think I'm not seeing, but I think Justin likely dropped it in the chat as well. And then the divisions, these are our research contracts. We'll also have up here contact information for the specific people who are in charge. We've tried to add, as many layers as possible so that people don't fall through the cracks. Anyhow, so that is that. Publication and presentation, I'm going to turn it over.
So promoting opportunities for publication and presentation. So a lot of that will start here with the Lunch and Learn workshops on publication and presentation. We've got a lot of local opportunities, such as our Department of Medicine Annual Research Symposium, which is actually the call for abstracts just went out, and if you haven't received it, I'm sure we'll send it around again, and that's going to be in end of September, I believe. So that's an awesome opportunity to interact with all the different faculty members and residents and fellows in the Department of Medicine. And we also have the William Solomon Quality Improvement and Patient Safety Symposium. And I just wanted to briefly mention our journal, UT's Journal of Translation. That's a really great opportunity to actually publish some of the projects we're working on. And we want to promote regional and national meetings, such as the example here. This is the Central Society for Clinical and Translational Research. It's a really awesome meeting held every year in the spring in Chicago. And you can see the pictures here from some of our students and residents that recently presented there just this past spring. So now I want to talk briefly about the certificate in clinical and translational research. So the reason we put this together is not everyone is going to have an opportunity to publish right off the bat. That takes time, right? but we want to give you something tangible to put on your CV to help get those competitive residencies. And I'll just briefly go through the criteria here. So active participation in the mentor student research program with a faculty member and completion of evaluation forms. On completion of assigned research curriculum city training modules. And a lot of those, most of you have already done through the M1 research curriculum. So congrats, you already meet one of the criteria. Participation in at least 8 of these lunch and learn workshops over the academic year. And author or co-author an abstract presentation at the annual Department of Medicine Research Symposium. All right, and now we'll get back to some frequently asked questions. So one, I've already filled out the research survey. Do I have to do it again? And the answer is no. Thankfully, your responses are already posted in the Biomedical Research Society webpage, so we've already have those and we've collected them.
So this is the one that we talked about last year, that in around September, November, that many of you filled out. If you haven't filled it out, go ahead and fill it out. But again, just to avoid that, it's the 5th time I filled this out. Like, that's been done, and God bless Justin for importing all those into the form. So if you filled it out, we've got it. If you haven't, we don't.
2, my interest survey has been submitted. What happens next?
So with this is really important. And I think that one of the things that we just, like Steve and I like to be really honest, we're probably like honest to a fault. But this is the truth, all right? We've designed a program so that you can participate in research. It involves human beings, all right? Unfortunately. Human beings, especially, physicians, are busy, right? And things fall through the cracks, and it's nothing's perfect. We often joke. Does anybody know what the term? Has anyone ever heard the term master adaptive learner before? So there's an adaptive in there, and if I hear that term one more time, I might scream. But the adaptive part means, one of those things is this is life, right? This is like getting prepared, like. When we did our PhDs and our master's degrees, not everything works out, and it takes some initiative, on our part. If you hit a roadblock and you throw up your arms and go, well, that was a waste of time or whatever, I can't help you. All right. So there are going to be roadblocks in this. This is nothing is going to be perfect, and we just want to have an honest conversation, right? You're gonna submit your thing and say, 3 months ago, I submitted something for cardiology research, and no one has, reached out to me and gotten in touch with me about how I can be, involved, all right? 2 things. 1, we want to encourage you, right, like, be proactive, right? If something isn't working out with cardiology, see if it, if it isn't. Maybe they're saturated with students, and there just aren't projects available. That's okay. If you did a research project in cardiology or a research project in nephrology, the residency that you're applying to really isn't going to care the difference. They want to see that you've done something, all right, that distinguishes yourself. So you may have to be adaptable and go, you know what, I really wanted to do a research project on pulmonary arterial hypertension, but instead I was doing it on chronic kidney disease. But guess what? Lots of people with chronic kidney disease end up getting, heart failure with preserved ejection fraction, and, things are related. So it's okay. So be proactive, and don't just say, well, like, when are Steve and Dave going to roll into my, apartment and, present my randomized controlled clinical trial? There needs to be some involvement on your part, some buy-in. We're going to do the best we can. Our job is to cajole the faculty and go, look, there's a lot of students who want to do, research in dermatology. There's got to be some projects here. Can you submit some projects so that all the students who are interested in derm or GI or whatever? So that's our job. And if there's, if you're not finding projects or whatever, you can communicate with us and say, I'm not finding projects. We can help guide you through, the decision tree about, should I bail on this and go to something else or whatever. But again, what happens? The Biomedical Research Society is involved You will hopefully get matched with a project. It might not be the project of your dreams, but our suggestion is, if you want to be involved in research and do something, do something. Both Dr. Haller and I had, up until 5 years ago, had done no direct research in the toxicology of environmental toxins that are produced by harmful algal blooms. Now, it compromises probably 80% of our lab, right? Like, no one told me when I was doing my PhD that I'd know what, microcystin was or any of these things. But by, so my background and Dr. Haller's background was just in general, molecular biology, et cetera. But by being adaptable, and when a problem presented itself with the harmful algal blooms, we said, hey, inflammation, fibrosis, those are things that we study and we know how to do, and we could, apply those to the harmful algal blooms. And again, that's what we're doing for the most part now. So
I
that's
just realized I can ask you. Who else is going to join the Big Ten? Can I be involved in the Biomedical Research Society and not this program, or vice versa?
And the answer is yes. They're not mutually, exclusive, and they're not. If you're involved in one, so you can. If you're involved in the Biomedical Research Society, there are other. The Biomedical Research Society has a program with surgery, right? So you can be involved in that way. And again, you could be involved in this and not. Maybe your mentor really doesn't want to work through Biomedical Research Society or whatever. The two are. You don't have to be involved in both. I would say the Biomedical Research Society is really a godsend and will help facilitate things, and it's a good idea.
No, I'm interested in research outside the Department of Medicine. How do I get involved in those projects?
So I think we've discussed about this, but again, Biomedical Research Society, Justin, I don't know, other than the surgery I know is involved, is there anything else, any other major things outside of medicine and surgery?
We have a pretty robust cancer biology program, but that falls well into medicine.
Okay, all right. So again, and if there's something that's not available, I'm really interested in pathology or whatever, you can let us know, and we'll slip a $50 to Phil to Dr. Gohara, and I'm sure she'll.
I know a pretty good pathologist. I have a great idea to improve the program. Who do I contact?
Funny, you should ask, Steve. So there's our contact information. We also have, obviously you can interact through the website, Amy, Diane, etc. So, let us know. This is, as I was just going, but again, be persistent. If you don't get a response in the amount of time that you think you've given it 48 hours or something, so please just say, hey, just bring this to the top of your email box again. So, because there's two of us and there's, a lot of medical students, so we do our best, but we are human and imperfect, and so anyhow. Questions from you, and then also questions, any online questions as well. I don't know if we can pull up the chat. Let me see the chat. Can I see anything? Closed caption. I think the chat is somewhere. I don't know, this is embarrassing. Anyhow, but as we're doing this, questions from you. So any questions on the program, comments, concerns, etc.?
So say that we get high.
What's your name?
Hi, I'm Wes.
Les?
Wes.
Wes, all right, Wes. Hi, Wes.
So say we submit this interest form and we don't hear anything back. So you're telling us to be persistent. So should we reach out to you if we're not getting any feedback? Should we reach out to the Department of Medicine that we're interested in? So what are like the practical steps that you recommend us taking?
Very good, excellent question. So what I would suggest is first, if you submitted this, I would communicate first with the Biomedical Research Society, because they should have a team member who's or a chair, I think Justin called them co-chairs, who are sort of the person who's the liaison with the division. So I first reach out to them. If they say, oh, listen, that was just an easy mistake, whatever, sorry, we didn't it, or I just got behind it, that's great, it gets all there. After that, I would escalate it up to us, and we can facilitate, the communication, and again, I am not gonna promise that, I don't wanna, overpromise, there's gonna be a perfect solution. But honestly, like, the people who have been involved in our lab, like, we do, like, tons of undergraduate research, master's degree, whatever. We've had, people join the lab, who like, they're like, gosh, I wanted to do cancer, and we're like, we work on hearts and kidneys. But like, they had a great, meaningful, experience, and that's really, the scientific method, it's applicable, and I, gave you the harmful algal bloom example, it's like, we didn't do any of that stuff, but, we're now, funded to do all this research that, 5 years ago, I would have never thought we were doing. And it's amazing, how organs are interconnected, so. Any other questions? And again, if you want to unmute for the M3s and M4s, if you want to unmute, and ask a question, please feel free to do so. I hope you can still hear us okay. All right. So if there are no more questions, again, we're going to do an encore of this for the M1s. We didn't want to throw everybody all together, but if you know someone who missed it, we'll do an encore for the M1s. That'll be at the end of August. Then in September, I believe September 21st is going to be the next lunch and learn after all the orientations are done, and that will be how do I formulate a research question. Right, and so we'll have a panel discussion with some of the senior faculty members here, so you can meet Dr. Dworkin and that, and a few of the other senior faculty members. So that'll be in September, on September 21st. So thank you guys for coming. Good luck with
Margaret,
fun.
Margaret, I saw you had your hand raised.
Oh, yeah, sure, go ahead. Margaret, you can.
Can you hear us okay, Margaret?
We can send it at that, so, but if you